So good morning and welcome. I'm Joyce Wall, President of the Roanoke Regional Chamber. We're joined today with Roanoke County Chamber, Smith Mountain Lake Regional Chamber, Salem Roanoke County Chamber, and Vinton Area Chamber to welcome you to today's program. The coronavirus, COVID-19, is a community concern, and your chambers wanted to bring you the facts. Useful information to help prevent issues that may arise in your place of business. We urge you to take copies of what we have to share in the back of the room, or to keep those online links handy for updating your teams. And those are constantly updated as everything is continually evolving with this coronavirus. First, I'd like to thank Roanoke County for the use of this excellent auditorium. We're in one of my favorite places, South County Library. I'd also like to thank RVTV for taping today's program that we'll put on our website later. For business owners large and small, that they may learn from it later. WDBJ 7, WSLS 10, and WFXR are live streaming today's program on their Facebook pages. And we're pleased also to partner with Korean Clinic to line up such distinguished guests who will be introduced more fully and briefly before they speak. Questions will be addressed after their combined presentation. Today's presentations include a situational brief from Dr. Laura Hornigy with the Virginia Department of Health. Before you become a patient, with Dr. Bafo Bani, Korean Clinic. Continuity in the workplace from Chris Turnbull with Korean Clinic. And if there are questions on the Commonwealth of Virginia's response plan, Mike Guzzo is here with the Virginia Department of Emergency Management to address them. As you checked in this morning, there were note cards for writing down your questions, and we would encourage you to write those questions on cards. And near the end of the program, our team will pick those up, and our panel will address as many as time allows. Now, right to our program. Dr. Laura Hornigy is the Health Director for Central Shenandoah Health District. The CSHD is one of 35 health districts that comprise the Virginia Department of Health. She's also the Acting Director for Roanoke Allegheny Health District. She attended the University of Virginia and has practiced internal medicine in the military, in the private sector, and in academic settings. She has a Master's of Public Health and has worked with the Virginia Department of Health for 5 years as the District Health Director. Please join me in welcoming Dr. Laura Hornigy.
Good morning. Thanks for having us here. The coronavirus situation obviously is rapidly changing and evolving, and what we wanted to share with you this morning were some websites and resources that you can use to keep up to date on the facts. The World Health Organization, Centers for Disease Control, and Virginia Department of Health all host websites that have excellent information that can be helpful to you in dealing with this outbreak. As we all know, yesterday the World Health Organization declared the COVID outbreak a pandemic, which just means what we're seeing, widespread transmission across the globe. And although the potential public health risk for COVID is high, individual risk is really dependent on exposure. So people with elevated risk for disease include people in places where there's ongoing community spread, and that would be person-to-person spread and not imported cases from outside the country. Healthcare workers who care for COVID patients, close contacts of persons with COVID, and then travelers returning from international locations with community spread. As of March 10, 2020, globally, there were over 113,000 cases, just over 4,000 deaths. Most of the cases are in China. Hotspots are defined as greater than 5,000 COVID cases with active community transmission, and the hotspot places that we're identifying now are China, South Korea, Italy, and Iran. For the latest national case count, you can refer to the CDC COVID-19 outbreak website. Cases in the United States that have been reported to the CDC as of yesterday, 39 states, including the District of Columbia, had reported cases. There were 938 total cases, 29 deaths. Of those cases, 771 are still under investigation, 92 were travel related, and 75 were person-to-person transmission. The VDH website can give you the latest COVID-19 testing and public health monitoring data for Virginia, and it's available at www.vdh.virginia.gov. And as of March 11, 2020 at 12 p.m., we had 9 positive or presumptive positive cases in Virginia. We had done 60 negative COVID-19 tests through public health testing. Cases have been identified in the following health districts: Arlington, Chickahominy, Fairfax, Loudoun, Prince William, Rappahannock, and Virginia Beach. Local health departments in Virginia are identifying people in contact with cases who may need to stay at home for 14 days after exposure, who may require testing, and who need to monitor themselves for COVID-19 symptoms. Community spread, that is person to person, has not been detected in Virginia at this time. Virginia's state lab started doing testing on February 29, 2020. Currently, they have a limited number of tests available, but more tests are on order. Because of the limited testing capability, it's important that public health use criteria to identify people who are at most risk of having been exposed. If we used all of our tests for folks who had no risk or low risk, we would impede our ability to identify cases. So BDH will request laboratory testing at the state lab for those who meet testing criteria. Private laboratories have started testing for COVID-19, and it's expected that access to testing will increase over time. VDH and all of our community partners have really been preparing for events like COVID-19, and we have plans in place. Now is really a good time for businesses, communities, faith-based organizations, schools, and healthcare systems to re-examine their preparedness plans and make sure that they're ready. The VDH website can be a great resource for prevention, preparedness, and response plans for all sectors of the community. If you look down the website, you can look at what your needs are and identify some excellent resources. People can protect themselves from respiratory illnesses, including COVID-19, with just some simple precautions. One is to avoid close contact with people who are sick. Avoid touching your eyes, nose, or mouth with unwashed hands. Wash your hands often with soap and warm water for at least 20 seconds. If you don't have access to soap and water, use a 60% alcohol-based sanitizer, and then use good respiratory etiquette. Cover your cough or sneeze with a tissue and then throw the tissue in the trash. There's currently not a vaccine or medication available for COVID-19, but there are interventions and actions that we can all do that can help slow the spread of the virus. These would include personal protective measures, such as respiratory and cough etiquette, community measures aimed at social distancing, like working remotely, remote school education, or postponing or canceling mass gatherings, and then environmental measures, routine cleaning of frequently touched objects and surfaces. Steps that communities can take to prepare for community transmission include collaboration with local health departments to review and implement their emergency operation plans, developing information sharing systems with partners, reviewing attendance and sick leave policies, performing routine environmental cleaning, creating good communication plans, and addressing prevention strategies and promoting all of those good hygiene measures, and making soap, water, hand sanitizers, and the like available to people around you. And then finally, communicating about COVID-19 and the prevention actions. Steps that individuals can take to prepare for community transmission, including taking preventive actions to stay healthy in general. People who are at higher risk of severe disease include older adults and those with multiple medical conditions. And they should have a good plan in place as to what they would do if they were to get sick. They should closely watch for symptoms and try to stay away from the ill by doing a little more social isolation. Individuals and households should also create emergency plans of action and know how you're going to respond should we see community transmission of COVID. So again, the World Health Organization, CDC, and BDH websites all have up-to-date factual information. Both the BDH, CDC, and World Health Organizations have good facts versus myths handouts that can be useful in teaching in communities. We appreciate your partnership in helping to address this public health concern, and thank you for your time this morning.
Thank you so much, Dr. Cornegie. We really appreciate that. Next, we have on our panel Dr. Anthony Baffo-Bonney, and he is the Medical Director of Infection Prevention and Control for Korean Clinic. He's also an internist and infectious disease specialist. He trained in the University of Ghana Medical School and was an infectious disease fellow for Virginia Tech Koreans Fellowship Program. He has been a Korean physician for 9 years and assumed his current role in October 2019. Please welcome Dr. Baffo-Bonney.
Thanks for having me here. And essentially, Dr. Carnegie has encapsulated or summarized virtually everything I was going to say. And so I'll repeat it because it bears, it's important that we understand that some of the actions that she talked about are very, very, very important in containment of pandemics. So in pandemic management, people talk about containment and mitigation. You do mitigation when you have a lot of community spread, and then you do containment to prevent having community spread. At this point in time, within Roanoke, we are not seeing any community spread. So this is the best time to be deliberate and to plan and to have ideas about what we do for containment. And so within the Karelian system, some of the things we are doing is to, when a patient calls for an appointment, we ask specific questions related to symptoms for COVID or really flu-like symptoms and help direct or triage patients to appropriate areas for receiving care. We also are in a forward-facing manner trying to advise the local population about things they need to do to decrease the risk of spread, and that also helps with influenza and other respiratory viruses to begin with. I'll go through some of the litany, probably not as eloquently as Dr. Carnegie. Wash your hands. It helps a lot. 20 seconds, good rub, it does it. Or alcohol-based hand sanitizers is also very important. If you are ill, don't go to work. Don't send the kids to school when you are ill, when they are ill, because they could be passing on something to somebody else. If you are ill, I know we love our grandparents and our grandparents love us, but that's the best time to use Skype or something else to communicate with them. Don't go see them, because when they get sick, they get severely sick. And we do know that with coronavirus, the death rate is higher in the elderly, in patients with comorbidities. And so we want to prevent that by, if we are ill, not going to see them. Does really help. If they are in nursing homes, you may probably have a loved one in a nursing home, and you may receive information that you probably shouldn't be coming to the nursing home. And the reason is to prevent what happened in Washington State or things like that. And so while these may be hardships, we have to plan around it. Give your loved one, if possible, a device that you can communicate with. The beauty is, this is the US. Ideas are abound. You know, we can use this as opportunity to develop other things. So let's say even with schooling, we know that coronaviruses generally, and this is not for this particular COVID, but generally coronaviruses and other respiratory viruses tend to have a lull during the spring and summer months, and they go up again during the fall and winter months. That's for general respiratory conditions. We probably should use that information, which we already have, to plan our school systems such that we are able to have some, I know school kids wouldn't like it if they hear this, some lessons or stuff during the summer when you have a lull, so that during the winter months, you are able to easily pull back. We have to be very flexible. This is something we can easily deal with so far as we plan for it. Within the Carillion system, we also have an incident management team that monitors or is monitoring very closely with the health department if there were to be introduction of a case. We define whether it's imported. Let's say the person traveled, was on a cruise, and comes back. We follow that, or we help. We tend to follow up that with the health department. And then if there is going to be local or community spread, the things that we do in terms of how patients will be, visitors will come to the hospital, there will likely be reductions in that as well to protect our loved ones whilst they are in the hospital. I think I'll end here. Thank you.
Thank you, Dr. Bafabani. I want to remind you now, actually, if you do have questions on the cards, if you've written one down, just raise it, just put your hand up, and we'll pick those up whenever you have them ready. Thank you. Chris Turnbull, many of you may know from his work leading Carillion's corporate communications team. You may not know that he recently took on an additional responsibility at Carillion for leading their operational continuity program. Chris has an extensive background in emergency management and business continuity, after spending a number of years at the World Bank as their Senior Business Continuity Officer for Global Operations. Planning for COVID-19 is not his first experience preparing for a potential pandemic. He helped develop the World Bank's pandemic response plans for H1N1 and swine flu. He's well suited to discuss what businesses and organizations in our area can do to prepare in the days and weeks ahead. In addition to his bachelor's and master's degrees, he's a certified business continuity professional. Please welcome Chris Turnbull.
Now allow me to switch out the PowerPoint here for just a second. This is the most tedious part of any presentation these days. Let's see. All right. All right, that was a lot easier than I thought it was. Good morning. So I'm taking, as Joyce mentioned, I'm going to take the discussion to the level of where many of you are maybe in the room. And we received a number of calls on Friday about a week ago about what businesses could do to help prepare for pandemic. So I'll walk you through some of those ideas. There's also a packet of information in the back. If you haven't picked it up, I recommend you do on the way out. It can help your organizations, businesses prepare for, ask the right questions as you prepare for pandemic. Let's talk a little bit about some definitions. For how many in the room is business continuity a new concept? There's a few. This is really the ability of an organization to withstand a disruption, to maintain its most critical functions in the face of some sort of interruption of that business. That is the goal of these plans. What I would say to make it more clear for pandemic planning, and need to ask our physicians up on the stage this as well, but we're planning for 2 months of a pandemic period where we may have to remain distant from each other in large part. So the goals of these plans that we'll talk about today are really focused on that 2-month period, that 2-month window. Why do we care? And I'm going to run through some of these overview slides pretty quickly because I want to get into the meat of what you can do now. But this is important. We care because all of these are the impacts of not having a plan. And research has shown time and time again that businesses that do not have plans have a much more difficult time recovering following some sort of incident than those that do have plans. So not to put a fine point on it, but all of these reasons are the reasons why organizations invest in business continuity. So we have 4 main purposes in these plans. One is to ensure that your time-critical processes, your time-critical functions are able to be maintained. Obviously, to safeguard your organizational assets, ensure that you can minimize the effects of a disruption, and then finally, and this is important too, making sure your teams know what to do. And that's a large communications and education effort in many organizations. It certainly is at Carillion in the work that we're doing right now too. If we had all the time in the world, if we were starting from scratch, the pandemic wasn't on the horizon, this would be the bulk of the work program for a continuity program. Creating a framework, building governance around it and policies around it, ensuring that we understand what the organization does, what's most critical, what could be put off for a little bit, what should be maintained no matter what. We would then look at what our recovery strategies were, and it looks like for pandemic, and this has stayed true over the last 15 years or so since I started in this world, pandemics really require social distancing. We've heard that over and over in the media and with our experts. That is the main assumption for your continuity plans for pandemic, that you are going to have to be distant from your workforce. So that's an example of a recovery strategy. It's the one that will most likely govern how we plan. Then we obviously develop the plans themselves, and importantly, we exercise them, maintain them, look at them regularly, and ensure that we are doing everything we can to be prepared. What I would argue is we have some time right now to get some of these elements in place. We probably don't have the time it takes to do all of them, and nobody's really predicted when the pandemic will come, but it's for lack of a better term, on our doorstep. So I would recommend, as you develop your institutional, your organizational plans, that you think about them in phases. And these are not phases of pandemic, so please don't align these with the CDC's phases, WHO's pandemic stages as well. But currently we have a limited spread in the state of Virginia. We'll probably get to a point where there's limited spread in the region, and ultimately we'll have more widespread illnesses in our area. Those are the phases, the triggers that we're using to help plan our responses. And so as we talk through these next few slides, think about them in terms of the different phases. They'll help us through. We're really in the process of preparing and mitigating. Eventually, when we get a couple cases, we'll be mitigating and responding. And then ultimately, as we get into that widespread illness, it'll be a full response for many of our companies and nonprofits and others. So think about what actions you might take at each of those phases. in terms of, and these are the details that are on the handout in the back. But think of this as an interim plan, as an initial step. Think of it as a way to get yourself prepared in the near term. But I would also say come back to this once we get through this pandemic and think through it more holistically. You will learn tons of lessons, and that's a good thing. We want you to identify your critical functions. What must be performed, what can be put off. Address staffing and HR needs, and there will be many in a pandemic scenario. Indicate what type of workflow disruptions you might have and think through what adjustments you might need to make. Assess and account for the things that you depend on, whether they be people, whether they be technology, other resources, supply lines. We'll talk through these individually here in a second. And then, of course, you heard it from our other speakers, plan for communications. That's going to be critical. Certainly, as your organization's plan, your employees will want to know what the plan is and how they can be a part of it, what they'll need to do. So let's go through these one by one, and I'll try to hit the highlights. When we talk about critical functions, most of the time we're talking about time critical. What is time critical? Everybody has a job to do. You wouldn't have a job if it weren't important. But what is most time critical? So think through that. And what functions and tasks need to be prioritized if, for instance, you don't have as much staff as you normally have, or you don't have the capacity, or you don't have the supply line that you typically do. So identify those critical functions first. That's an important first step because the other steps flow off of those functions. Talk about staffing needs in relation to those functions. What's the minimum staffing requirement you might need to perform a particular function? If you have certain, leaders in general, and if you have certain staff members that perform a unique function, figure out how that could be backed up. We're looking at our leadership team. We did this yesterday in our marketing department at Carillion. Who among our leaders or who among our department personnel could back up for our leaders if they were somehow unavailable? They were sick at home in bed, or were taking care of their children, or you name it. So think through that. Who could back you up? Who could back your key people up? And make sure that's a part of your plan. What tasks are required on site, either in your facility or at a facility? And then what tasks might be able to be done at home or at a remote location? Think about how you might staff a function that is critical, where you may need to be on site, but maybe not everybody needs to be there, and they can be distanced in the room. Think of a call center where you might have a limited staff in the four corners of the room where they're not near each other and remain isolated in that sense. Think about the dependencies that you have, and think about particularly the vendors that support you. And could there be vendors that support you specifically in a scenario where you're not able to do your normal operations? It's a little bit more challenging in a pandemic scenario where the disease is widespread and is currently impacting multiple areas of our country and our world, but it's still worth thinking through as you go through your planning. I didn't put it on here, but it begs talking about. You're probably going to need some specific HR policies that address this type of scenario. Think through that. If you pull your employee manual out, look through those policies. What's your work from home policy? Are you asking individuals who may not have a risky job in general to do a more risky job now that there's a pandemic? So think through those policy implications as well. This is it's one bullet, but it's a big deal. Your workflow is going to change. So try to figure out what that might look like if you were in a dispersed work environment, or if you must be in your facility. Like I said before, could you reduce it to a skeleton crew? Could you work shifts? Could you do things that enable the work to be done, but keep people distant from one another? Plan communications. I don't need to put too fine a point on this, but this is the other half of my job, which I love. You want to make sure that you're able to communicate with your employees, your teams, your external partners, your vendors, all of those folks. Have a plan in place. Make sure you're telling them what that plan is. These plans, by the way, shouldn't be secrets. particularly from your staff. There may be some elements that you don't want public, but generally speaking, you want your staff, you want your customers, your clients to know how you're going to manage this. And I don't know if you all have gotten the umpteen emails in your inboxes this week. Many businesses, larger businesses, are thinking through that and pushing messages out to their clients and potential clients about how they'd operate. And then this is maybe a detail here, but one that we don't think about mail that much anymore because we get so much electronic communication, but some of you likely get packages at work or likely get important mail at work. How would that flow if you weren't able to be in the office? And then lastly, and I put this blue box at the bottom because it's probably the most important point I can make, you have what you have right now. I think you've all seen that supply chain across the globe is hampered in a lot of ways. Don't assume you're going to have more than you have right now. Your plans should be based on what you currently have available. The staffing that you have, the technology that you have, the web conferencing tools that you have. These types of things, what you have right now is what you got. And that's an important note. Think through what technology elements you do have that you could enable a dispersed work environment, if that's a possibility for you. Think about what vendors, and I mentioned this before, but think about what vendors you can rely on, what their plans are. Try to understand that well. And if they weren't available, what would you do? I'm going to stop there, but with a few key takeaways. Nothing that I've talked about today is rocket science. That's important. It's not intended to be. It does take some intention and it takes some time. And so my recommendation is get together with your leadership teams in your organizations or in your departments, if that's the case, and talk through these questions that are on the handout, same ones here in the slide deck, and make that first move. If you don't have a plan, this will get you to the next level. And if you do have a plan, this will take you to the one after that. The process, and I would encourage you to think of this as a process, less a project. This is something that should be ongoing. This is a great opportunity, and if there is a silver lining here, I think it's that more people will be more prepared for the next time this happens. This is a great opportunity to take advantage of that moment and build plans in place. Get plans in place for your organizations. Lastly, I want to remind everybody, if you raise your hand if you need a card or if you have questions. I think there's a couple folks that have cards around, and I think what we're going to do, I'm going to sit down and I think we're going to do a Q&A. But thank you, and hopefully good luck planning on all the next steps for your organizations.
Thanks so much, Chris. That really kind of touches home in a different way. And I don't know about you, but I haven't heard much of that on news reports of any sort. So we've got a couple of questions already. Write yours down, hold them up, and we'll get to all the others. Chris also made some extra very good points. It would be impossible to touch on every single thing that is important in today's basically 1 hour program. But I would like, in addition to the printouts and in addition to the websites, if there are HR questions or legal questions I would encourage you to then talk to your attorney if you don't have one. There are a lot of really good employment lawyers, law firms even, that you can find on any of the chamber websites. And, be sure you go to the right sources for the right things, is what I would encourage you to do. So our first question to our panelists, and you've got your mics. So if COVID-19 appears in the Roanoke Valley, how does that change things here? Who wants to start? Dr. maybe Cornegie? Just give it a second.
I don't think it changes things that we're doing now in terms of preparation and mitigation strategies. We'd have to watch closely for evidence of community spread, and I think what would increase would be those social distancing things, perhaps canceling large gatherings, getting a little more space, doing the teleworking, teleschool that gets people a little bit more of that social distance to prevent spread of disease. Would you have anything to add, Doctor?
It's a very good question. So COVID-19 as a disease could be, let's say, seen in this area, and could be from somebody who went to Hubei, China, and just showed up. That is different from identifying COVID-19 in a person who has been nowhere and you can't really find the contact. So two different things, one same case, but two different things. If it's, let's say, from somebody from Hubei, China, what the health department does is quickly do contact tracing and make sure that social isolation is occurring amongst all people who have been exposed to that particular patient. If it's the second type of patient where you are not finding the source, that suggests community spread, and that is what we are already planning for, meaning we want to be practicing the things that will prevent spread ahead of time, so you decrease that risk of spread to begin with. Therefore, planning to make sure that you have you can do work from outside of your work area is important. Making sure that if you are ill, you call to your provider ahead of time so they can direct you in the right way to be seen is important. Making sure you do not go to school or to work when you are ill. These are all assumptions that you have something and we want to prevent you from spreading it. That's the thoughtful way of going around it. Not to panic, but to do these basic things. That's when you also quickly say, you're probably not going to be doing large gatherings. You want to avoid that because you don't know who is coming from, whether they're coming from an area where there is already widespread disease and it's going to be in the midst of your gathering. So those are some of the things I would suggest or would happen when we see COVID-19.
Great, thank you. So we've seen a lot of programs in especially large communities canceled where there are large gatherings, and we have a big parade coming up Saturday here in the Valley. What are your thoughts about outside events versus inside events?
That's a very good question again. So anything one can do to minimize the closeness as well as the ability for somebody who's coughing to cough on you, that is significantly helpful. Large size events where you are getting participants from places where people are sick, you probably want to consider that carefully. Event organizers may benefit from sending out information ahead of time, to dissuade people who are ill from coming, to these events as well. Just very thoughtful ways of working around this.
Great. This leads right into another question we have. What do you expect, or do you expect Roanoke's emergency rooms to be overcrowded? And related to that, what would that mean for other illnesses? One of you docs? Okay. Okay.
Yeah, I think, with any widespread outbreak of disease, there is potential to flood emergency rooms. I think what we need to do is do good education of the community about where they should go to seek care. As Dr. Bapambani mentioned, if you feel like you have symptoms that could be associated with COVID-19, calling that provider's office, talking it through, finding the best level of care that may suit your needs. If you're young and otherwise healthy, the emergency room may not be the greatest place to go, and it risks introducing disease into a facility where older, sicker folks who are more susceptible to the infection would be.
I agree with that 100%. So a little bit about COVID-19. 80% of people who get infection have mild symptoms and are able to stay at home. And that's a little bit of the danger of it, because they have mild symptoms, so they're doing stuff around. So when you are feeling ill, please reach out to your doctor so that they are able to advise you on the appropriate social isolation practices that will be helpful to keep the community safe. However, 80% of people do not need hospitalization. The persons who end up being hospitalized are the elderly and people with comorbid conditions. And so for those persons, right now, you want to start the things that decrease your risk of coming into contact with COVID-19. I'll just give an analogy. Probably not the best analogy, but if you have a highway and you have cars going back and forth, your risk of being hit by a car if you're crossing the highway is highest if you're running back and forth all the time versus if you do it only once. It's the same with COVID-19. So if you are somebody who has heart disease, has respiratory disease, just like Tony Fauci said, don't go on a cruise because the likelihood would be higher there. Don't go for big gatherings. The likelihood would be higher there. Probably if you have grandkids who are, sick and sickly, kids are sweet, but they have a lot of germs sometimes. You want to stay away from them and maybe use other devices to communicate. These are simple, basic things that we want to do that will keep us essentially safe.
Good, thank you. A little bit different tact here. Is there a recommended household plan, and what should we stock and for how long?
Advice there?
There is a website called ready.gov that gives general planning for all hazard emergencies. Things that you should have on hand would be about a 2-week supply of food. Have your medications that you need on hand. Have things that you can use to sanitize the environment, to wipe down counters and the like. For all hazard planning, you would certainly want to have, things like, batteries, water, those kind of things. But in this instance, we're thinking more related to isolation due to threat of transmission of disease. So, having things that you would need to hunker down for about a 2-week period, in your house would be important. The forgotten member of our house is always the Labrador Retriever, so remember to have food for him as well.
And let me add one thing to that as well. I know that FEMA also has resources for businesses out there as well for your plans, so that's another great resource. I didn't put that on my slide deck, but that's an important one.
And so there's a question about the slide deck, actually. I know we have the information that's front, back, in pages, and we'll post some of those also on our website, but will the slide deck be available?
Sure.
Okay, you give that to us and we'll post that as well. And is there a range for the maximum number of attendees at a gathering or, for social distancing? Is there a range? I know we've heard 100 at times.
Depending on what you're reading, you're going to see different things. I'm not sure if there's any data. Are you aware of any?
I don't think there is. I think some of it would depend on, how big the venue is, how close people are going to be. We, in general, like to have about a 6-foot distance to prevent spread of disease. I think the other thing to consider too is who's going to attend the event. In talking with my elderly parents in Florida, they asked about going to a very crowded dinner theater, and were concerned about spread of disease, and they're kind of elbow to elbow with other senior citizens. And I thought, at this point in time, you may want to rethink that. So if you're in a high-risk group, or you're doing events, they're going to attract a lot of high-risk folks, particularly older and folks with medical issues. That's going to go into your planning as well.
Essentially, we have to be creative.
Mm-hmm.
A lot of what you're seeing organizations do across the country and around the world is, the phrase is out of an abundance of caution.
Yes.
And that seems to be the mode that many businesses are also taking. So encouraging remote meetings when possible to get people familiar with the technology, things like that. Those types of efforts are happening all over the place now. And this is a great time to test those out.
So here's another good question about special considerations, like in food preparation and service. So are there any special considerations in food prep and in service organizations?
I think the general things apply generally. If one has a respiratory condition ongoing, it means you're sick, you don't want to be showing up to work work in a restaurant or something like that. That's a general thing all through. I don't think there are unique things about COVID and food. You have had anything?
No, it's mostly just that, encouraging folks who are sick to stay at home. Part of VDH's core function are restaurant inspections, and as part of that, we've been providing a lot of education to food service workers on what they can do to keep themselves healthy and to keep their customers healthy as well. And most of that is just staying home when sick, and then excellent hand washing.
So related to that, what is the life of the virus on surfaces such as, serving utensils?
So the data for the life of a virus really comes from the data for the SARS virus, the sudden acute respiratory syndrome coronavirus. This was sometime in 2002, again in China. We don't have the virus around yet, as at this time, different from this current coronavirus. That's what has been studied more extensively. If you read the literature, you have people talk about 12 hours up to even a week, depending on what type of literature you're reading. So there's a broad range of time span where it can survive as a formite. It also depends on the temperature, humidity, and a host of other factors.
Great. What do you suggest for businesses handling money and currency through like a cash register, since the virus supposedly lives on services for a certain period of time? And some customers, of course, insist on using cash.
I'm going to be a broken record and say proper hand washing technique. Make sure you're washing your hands regularly using alcohol-based. And I think that's, if you're in a bank and have the hand sanitizer right next to the teller windows, that's a perfect place for it. If you're in a business where it's heavily cash-based, make sure that those hand sanitizers are available. I recognize that they're probably about $100 per container now. But that would be ideal, or
If you can get them.
If you can get them. Or soap and water. I mean, we've
soap and
mentioned
water.
it many times. So
And maybe
that's
gloves.
So I didn't know this question, but the first thing we talked about was hand washing, because it's very, very important. Hand hygiene, very, very important. We all touch our faces after we've touched stuff. And so that prevents this and even other things that we don't know, we don't know about yet. So I think hand washing is key, or hand hygiene is significant key here.
So protect yourself. Keep washing those hands. How should a child care facility prepare for additional demand?
Who wants to tackle that one?
Again, childcare facilities. One of the things you want to do is, because we know there's fomite spread, making sure that with each day on consistent basis, appropriate cleaning with approved chemicals that are safe for the children, as well as safe for varicidal in nature. On a consistent basis, maybe if you're cleaning the place once or twice a day, you want to increase that amount. When there is a sick kid, one has to have policies to make sure that you're not introducing sick kids into the childcare. That's also another important thing to do.
From a continuity perspective, it may make sense at some point to screen sick children or ensure that the sick children aren't coming into the childcare, so that you're not exposing others to that. These are types of things you can think about that we recognize, and I've seen it in numerous news reports, how challenging childcare will be if we move to more of a socially distanced workforce in schooling, for that matter. So those are, I think, assumptions that we can make at some point that might happen in certain communities. It's happening, I think, a little bit in Washington State right now. And admittedly, the child care organizations are in a difficult spot with that.
Mm-hmm. And I think your family-based emergency plans are really important. Most of us are two household workers, so sitting down with your spouse and figuring out how you're going to manage lack of child care, because your child care provider may be the one who's sick, and who's going to go to work and who's going to stay at home, and kind of having a plan in place for that.
Let me add also, I think that's a great point. Let me add also that these are should be parts of your organization's continuity plan. Expecting staff absences due to child care, that's a key reason that people will be absent. It's something that we're working through as well at Carillion.
Good points. This is our last question, and then we'll wrap up out of respect of your time, and then our speakers will be here for a little bit longer at the end of the program. So with the lack of testing available and heightened concern in the workplace, what criteria should be used for allowing staff members to return to work after being sick? How many of us have known people who have had these persistent coughs, even though they were otherwise well?
These are all the easy questions. Thank you. Appreciate that.
That's a tough one. During flu season, our general recommendation is that people stay home until they're 24 hours fever-free without using fever-reducing medications. If you're thinking COVID, the recommendations could be different.
And those recommendations will evolve if we start to see community spread of COVID. I don't think we will have come say with certainty the things, because they will evolve.
Very good. All right, so as we wrap up today, I'm just going to use a quote that Lao Tzu, famous philosopher, said years ago: "To know and not to do is not to know." So with what you've learned, put that into use, and the continuity plan and some of the other advice that we've gotten, I think, has been very useful today. I'd also like to thank again Roanoke County, South County Library. Thank you, Mike, for also assisting us today and get all the technology together. RVTV, Alan, thank you. And we'll post a link on our website and for social media for later viewing of the taped presentation. And thank you to Grant Holmes with Roanoke Chamber, Beth Bell with Salem Roanoke County Chamber, Chris Finley with the Smith Mountain Lake Regional Chamber, and Angie Tuning Lewis with the Benton Area Chamber. We came together to help spread the word on today's program, spread facts, not fear. Thank you again to our wonderful speakers and Carillion for helping to put this together very quickly. And lastly, thank you for attending, for learning more. Now that you're armed with the facts, we trust that you gained some additional insights into the coronavirus, COVID-19, and are better equipped to prevent its spread in your place of work. and wherever you go. Some of our speakers will be here for a little while longer. Let's please give them a round of applause to thank them again for sharing their expertise. So we are adjourned.
And just to spread the knowledge a little more widely, Roanoke Allegheny Health District will be presenting some COVID information sessions. We'll have a flyer available outside, but talk about that with community members who may need more education. Thank you.
Thank you. Appreciate that.